Distinguished guests, the President of the United States.
Hello, hello, hello. By the way, that little thing up in the air there, don't worry about it. It's not armed. Good evening, everyone. Prime Minister Albanese, Prime Minister Modi, and Prime Minister Kishida, and Governor John Carney, Senator Chris Coons, and Representative Lisa Blount-Rochester. All the scientists and doctors and advocates here tonight, what a fitting way to end the Quad Summit by launching another historic endeavor. When I was Vice President, Jill and I launched here in the States what we call the Cancer Moonshot. We committed to end cancer as we know it and reach 50% cure for cancers in a time frame that we announced. We had lost our son to glioblastoma in 2015, Bo, a graduate of this great institution. And like many mothers and fathers, quite frankly, we were ready to give up. But I wasn't going to run again. My son, Bo, knowing he was going to die shortly, pulled me aside, not a joke. I wrote about it, made me promise that I wouldn't walk away, that I'd stay involved, because he knew the impact if we stayed and made the case. I remember him saying to me, "Dad, this is God's truth. Dad, I'm not afraid. I'm going to be okay." He knew he was about to die. But he said, "You got to promise me you'll stay involved," because he knew the way he had talked about it, that it would give people hope, that those of us and many of you experienced it. I bet if I ask you to raise your hand, including the press, if anybody has lost a family member or has been diagnosed with cancer, it's the vast majority of you. And it seems to me there's nothing that families and or the person suffering from cancer needs more than hope. Hope. Hope that science will outrace the disease. After Bo died, I literally visited every major cancer research facility in the world, 7 of them around the world. I wanted to see what was possible, and I did. And by the way, I didn't do it alone. I want to thank Danielle Carnival, who's here. Where are you, Danielle? I want people to see you, who was an effort, Doc, and worked on putting this together for me. During those trips, I got to see the incredible dedication that scientists, doctors, and nurses. By the way, having spent a lot of time, like many of you have, in hospitals, doctors let you live. Nurses make you want to live. They give you, you male and female, you think I'm kidding. They had hope. And they're making significant progress, all of you, those of you scientists out here. And it's not just because it's personal, but because it's possible. When I became president, we reignited our cancer moonshot with an ambitious goal. Cut the cancer rate by at least 50% over the next 25 years, or even cure many cancers. Throughout this effort, what amazed me was that leaders around the world asked about the cancer moonshot. Its mission that brings us, that's the mission that brings us together tonight. And one that brings the best of us. That's why we're here today. I'm proud to announce that the Quad Cancer Moonshot is what we're talking about. Our goal is to team up and cancer around the world, and starting with cervical cancer. I know it may sound unrealistic, but it's not. Cervical cancer is one of the most preventable cancers in the world. In fact, we have prevention and screening tools and treatments to make the first cancer ever be eliminated. Yet it's still one of the most deadly cancers across the world. Every year, 150,000 women die from cervical cancer in the Indo-Pacific. Every year. That's more than double the population of this city. We can't and will not let that continue. The 4 of us are proud democracies. We're coming together to deliver a better hope, more hope for our people. In practice, the Quad Cancer Moonshot means more collaboration between our hospitals, research centers, and cancer foundations, more investment in screenings, treatment, and research, and more exchanges between our countries to improve vaccination rates all across the region. Right now, only 1 in 10 women across the Indo-Pacific, which is the most populated part of the world, have received HPV vaccinations for cervical cancer. So I'm proud to announce that our 4 countries, the leaders behind me, and many organizations here today are committing over $150 million for HPV screening and therapeutics. And next year, doctors and nurses from the U.S. Navy will begin a program to train Indo-Pacific counterparts in conducting cervical cancer screening and vaccination so we can reach every woman in the region. And it matters. Folks, let me close with this. During my first year as president, I received a letter from a mother from Tennessee. She'd been recently diagnosed with cervical cancer. She said she experienced every emotion, from denial to anger to fear to grief. Jill and I remember those feelings as well. But when she asked herself, what am I going to do? Am I going to give up? Am I going to fight? She answered, I choose to fight. We've got to choose to fight. Choose to fight as a society. Ladies and gentlemen, today America, Australia, India, and Japan choose to fight. For every patient asking for one more day, one more week, one more year. Every survivor and caregiver who carries the scars of recovery, and every person who's lost, and every person we can save. Because there's truly nothing beyond our capacity when we act together, not even beating cancer. And that's what this group is about today. So I want to thank you all for being here. And now, who am I introducing next? Who's next?
Distinguished guests, the Prime Minister of the Republic of India.
By the way, he's from a small country like ours, with slow population, but he's become a good and decent man and a good friend.
Thank you. Excellencies,
Excellencies,
इस महत्वपूर्ण कार्यक्रम के आयोजन के लिए
I thank
मैं राष्ट्रपति बाइडेन का
President Biden for
हार्दिक अभिनंदन
organizing
करता
this very important event.
यह अफोर्डेबल
This demonstrates our
एक्सेसिबल
shared firm
और
resolve
क्वालिटी
to
हेल्थ केयर के
provide
लिए
affordable,
हमारे
accessible,
साझे
and
दृढ़ निश्चय को
quality
दर्शाता है
healthcare.
कोविड पैंडेमिक
During
के
the
दौरान
COVID-19 pandemic, we
इंडो पैसिफिक के
took
लिए क्वाड
the
वैक्सीन
Quad
इनिशिएटिव लिया
vaccine
था
initiative for the Indo-Pacific, and
मुझे खुशी है
I'm pleased
कि क्वाड
that
में
in the
हमने
Quad we
सर्वाइकल
have
कैंसर
decided
जैसे
to
चैलेंज
face
का
the challenge
मिलकर सामना करने का
of
निर्णय लिया
cervical cancer together.
इन कैंसर केयर
In cancer
कोलैबोरेशन
care, collaboration
इज एसेंशियल फॉर
is
क्योर
essential for cure.
कैंसर का बर्डन
In
कम
order
करने के
to
लिए
reduce the burden of cancer,
प्रिवेंशन
it is necessary
स्क्रीनिंग
to have an integrated
Diagnosis
approach
और
of
ट्रीटमेंट
prevention,
की इंटीग्रेटेड
screening,
अप्रोच जरूरी है
diagnosis, and treatment.
भारत में मास स्केल पर
In India,
बहुत ही
an
कॉस्ट इफेक्टिव
exceedingly cost-effective
cervical
cervical
cancer screening
cancer screening program
चल
is
रहा है
being implemented on a
साथ
mass
ही
scale. At the
भारत
same time,
दुनिया की सबसे
India
बड़ी
has also
हेल्थ
implemented
इंश्योरेंस
the
स्कीम
world's
चला रहा
largest health insurance scheme,
है और सबको
and
अफोर्डेबल कॉस्ट
special
पर
centers
दवाइयाँ
to
उपलब्ध कराने के
provide
लिए
generic medicine
स्पेशल
at
सेंटर्स भी बनाए
affordable
गए
costs have
भारत
also
ने
been set up.
सर्वाइकल कैंसर के
India
लिए
has also
अपनी वैक्सीन भी
developed
बनाई
its own vaccine for cervical
और
cancer.
एआई की
And
मदद से
with the help of
नए
AI,
ट्रीटमेंट
we
प्रोटोकॉल भी
have also
शुरू किए जा रहे हैं
implemented new treatment protocols.
एक्सेलेंसी
Excellencies,
भारत अपना
India
एक्सपीरियंस
is ready
और
to share
expertise
its experience
शेयर करने के
and
लिए
expertise.
तैयार है आज कैंसर केयर में काम करने वाले
Several Indian
भारत के
experts
कई
working in the
experts
field of cancer
इस
care
इवेंट्स में
have
हमारे साथ
also
जुड़े
joined us at this event
भारत का
today.
विजन है
India's vision
वन अर्थ
is one
वन
earth,
हेल्थ
one health.
इसी भावना
It
से
is
मैं
with this sentiment
क्वाड
under
मूनशॉट इनिशिएटिव
the
के
Quad
तहत
Moonshot Initiative, I
$7.5
announce
मिलियन के
and
सैम्पलिंग
assistance
किट्स,
of sampling kits,
डिटेक्शन किट्स
detection
और
kits,
वैक्सीन्स का
and
सहयोग देने की
vaccines worth
घोषणा करता हूं।
$7.5 million.
रेडियोथेरेपी ट्रीटमेंट
India
और
will
कैपेसिटी
also
बिल्डिंग में भी
provide support
भारत
in radiotherapy
सहयोग देगा।
treatment and capacity
मुझे खुशी
building.
है
I am
कि
pleased
इंडो पैसिफिक
that
देशों के लिए
for the countries of the
गावी
Indo-Pacific,
और क्वाड की
under the
पहलों
initiatives of
के
Gavi
अंतर्गत
and Quad,
भारत से 40
40
मिलियन
million
वैक्सीन डोसेज
doses
का
of
योगदान
vaccine will be
दिया जाएगा।
contributed by India.
ये 40 मिलियन
These
वैक्सीन
40
डोसेज
million doses of
करोड़ों
vaccine
लोगों के
will
जीवन
be
में
rays of hope
आशा की
in the
किरणें
lives
बनेगी।
of millions of people.
As you can see, when the Quad acts, it is not just for nations, it is for the people.
As you can see,
This
when
is
the
the
Quad
true
acts,
essence of
it is
our
not just for nations, it is for
human-centric
the people.
approach.
This is
Dhanyavad.
the true essence of our human-centric approach. Thank you.